There are several different types of bispecific T-cell engagers currently in clinical investigation. The majority of these target BCMA, which is expressed in myeloma cells. And I would highlight that several of these are advanced in clinical trials, completing phase 1 studies. And as I mentioned, they have very promising response rates and deep responses. I would point out 2 other agents that are currently in investigation. The first is a Janssen molecule which targets a protein called GPRC5D. And GPRC5D is a member of a class of receptors called 7-transmembrane G protein coupled receptors. It is uniquely highly expressed in myeloma cells and 1 or 2 other tissues. And this agent has shown very promising activity in early phase clinical trials. We're expecting a report at ASH this year. And it is an alternative to the BCMA targeted strategies which have been largely dominating the field. The second is an agent that is produced by a company called Glenmark, and that one targets CD38, which also is the target of daratumumab, which is already approved for multiple myeloma. And it's actually testing a principle which has not been deeply investigated yet, which is if a monoclonal antibody such as daratumumab is effective in myeloma targeting CD38, will a bispecific agent, which then directs T cells to kill cells that are expressing CD38, have similar effectiveness or even greater effectiveness?